Common disorders of the male reproductive system. Several disorders can affect the male reproductive system, leading to infertility, sexual dysfunction, or other health issues. These disorders can be related to the testes, prostate, penis, or hormonal imbalances. Here are some common disorders. 1. Erectile dysfunction, ED. Definition: erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. It is a common condition that can occur at any age but is more prevalent in older men. Causes: physical causes, cardiovascular disease, diabetes, high blood pressure, obesity, hormonal imbalances, e.g., low testosterone, neurological disorders, and side effects of medications. Psychological causes: stress, anxiety, depression, or relationship issues. Treatment: phosphodiesterase type 5 inhibitors, AG, sildenafil, to increase blood flow to the penis. Psychotherapy or counseling for psychological causes. Lifestyle changes, e.g., weight loss, exercise, quitting smoking. Second, male infertility. Definition: male infertility is the inability of a male to impregnate a female, usually caused by issues with sperm production, function, or delivery. Causes: sperm production issues, low sperm count, oligospermia, no sperm, azoospermia, or poor sperm quality, poor motility, abnormal morphology. Varicocele, enlarged veins in the scrotum that can impair sperm production. Testicular torsion, twisting of the spermatic cord that cuts off blood supply to the testes. Infections, sexually transmitted infections, mumps, and other infections that can affect the testes or prostate. Hormonal imbalances, low levels of testosterone, high levels of prolactin, or problems with the hypothalamus or pituitary gland. Treatments: surgery for varicocele or testicular torsion. Hormonal therapy to correct imbalances. Assisted reproductive technologies, ART, like intrauterine insemination, IUI, or in vitro fertilization, IVF. Third, ejaculatory disorders. Definition: ejaculatory disorders include conditions such as premature ejaculation, retrograde ejaculation, and delayed ejaculation. These conditions interfere with the normal process of ejaculation during sexual activity. Types: premature ejaculation. Ejaculation that occurs too quickly during sexual intercourse, often due to psychological or neurological factors. Retrograde ejaculation. Semen enters the bladder instead of exiting the penis during ejaculation, often due to nerve damage or prostate surgery. Delayed ejaculation. Difficulty ejaculating, often caused by psychological stress, medications, or nerve damage. Treatment: behavioral therapy for premature ejaculation. Medications like selective serotonin reuptake inhibitors, SSRIs, for premature ejaculation. Surgical or medical treatments for retrograde ejaculation, such as medications or procedures to correct bladder function. Fourth, testicular torsion. Definition: testicular torsion occurs when the spermatic cord twists, cutting off the blood supply to the testicle. It is a medical emergency and can lead to permanent damage if not treated quickly. Symptoms: sudden severe pain in one testicle, swelling of the scrotum, nausea or vomiting. Treatment: surgical intervention to untwist the spermatic cord and restore blood flow to the affected testicle. If not treated within hours, the testicle may become necrotic and require removal. Cinquième, varicocele. Definition: a varicocele is an enlargement of the veins within the scrotum, which can impair sperm production by increasing the temperature in the testes. Symptoms: a feeling of heaviness in the scrotum. Visible or palpable enlargement of veins in the scrotum can be associated with infertility. Treatment: surgical correction, varicocelectomy, or non-surgical methods like embolization to reduce the varicocele and improve sperm quality. 6. Prostate disorders. Definition: disorders of the prostate gland can affect both urinary and sexual function. Common prostate disorders include benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. Types: benign prostatic hyperplasia, BPH, non-cancerous enlargement of the prostate gland that can cause urinary symptoms like frequent urination, weak stream, or difficulty urinating. Prostatitis, inflammation or infection of the prostate, often causing pelvic pain, painful urination, or sexual dysfunction. Prostate cancer, cancer of the prostate gland that can lead to symptoms such as difficulty urinating, pelvic pain, and erectile dysfunction. Treatment: BPH. Medications, e.g., alpha blockers, 5-alpha reductase inhibitors, minimally invasive procedures, or surgery. Prostatitis, antibiotics or anti-inflammatory medications, prostate cancer, surgery, radiation therapy, or hormone therapy, depending on the stage and spread of cancer. 7. Hypogonadism, low testosterone. Definition: hypogonadism refers to low testosterone levels, which can result in symptoms such as fatigue, reduced libido, erectile dysfunction, and infertility. Types: primary hypogonadism, caused by dysfunction of the testes. Secondary hypogonadism, caused by dysfunction of the hypothalamus or pituitary gland. Causes: testicular failure, e.g., due to injury, infection, or genetic conditions like Klinefelter syndrome. Pituitary or hypothalamic disorders, aging, and certain medications. Treatment: testosterone replacement therapy, TRT, through injections, patches, gels, or pellets. 8. Cryptorchidism, undescended testicles. Definition: cryptorchidism is a condition where one or both testicles fail to descend into the scrotum during fetal development. Complications: increased risk of testicular cancer, impaired fertility due to higher temperature in the abdomen. Treatments: surgical intervention, orchidopexy, to move the undescended testicle into the scrotum. 9. Sexually transmitted infections, STIs. Definition: STIs can affect the male reproductive organs, leading to infertility, pain, or chronic conditions like epididymitis or prostatitis. Common STIs, chlamydia and gonorrhea, can cause epididymitis and infertility. Human papillomavirus, HPV, can cause genital warts and is linked to an increased risk of penile cancer. Treatment: antibiotics for bacterial STIs, e.g., chlamydia, gonorrhea. Antiviral treatments for viral STIs, e.g., herpes, HPV. 10th, penile disorders. Definition: various conditions can affect the penis, leading to dysfunction or discomfort during sexual activity. Types of Peyronie's disease, development of fibrous scar tissue in the penis, causing painful erections and curvature. Phimosis, a condition where the foreskin cannot be retracted over the glands, causing pain and potential infections. Priapism, a prolonged painful erection not associated with sexual arousal. Treatment: Peyronie's disease, medications, injections, or surgery. Phimosis, topical corticosteroids or circumcision. Priapism, medical intervention to relieve the erection, such as ice packs, medications, or aspiration. These conditions can significantly affect a male's reproductive health and quality of life. Early diagnosis and treatment are crucial to prevent complications and manage symptoms effectively.